Yes, Dr. Zib, you're audible.
Okay, okay, brilliant, brilliant. Thank you so much, Mahvish. How are you? Okay, brilliant. Thank you, Lubna. Thank you, Amna. Hi, Ruj. So I'm here, yeah. Okay, okay, brilliant. So formally welcome all of you on the MediCorix platform. So we are going to be talking about MRCOG Part 2, how we are going to start, how we are going to crack, and how we are going to pass this exam. Okay. So before I go on and they start discussing about that how we are going to go about this part two, I know many of you have already started studying. So just give me an overview that how do you guys find it? Like, I mean, difficult, overwhelming, or impossible or difficult? Four things. Just answer me with one answer. You know, difficult, overwhelming, impossible, or you don't want to try for it because it has got all elements or all components. Overwhelming, brilliant. Difficult, overwhelming, yeah. This is overwhelming, yes. It's not too difficult but needs, yes, overwhelming, brilliant. Anybody who has answered with this overwhelming word, they have got the gist of this exam, that how this exam works and how much you do have to study, all right, and how much you have to work hard for this, all right. So I am not going to say that this is something out of the world or this is something out of the box exam, okay, because syllabus is kind of never ending, syllabus is kind of the huge, all right. So it becomes overwhelming, every day you have to push yourself that no, I have to study, no, I have to do this, isn't it? So every day, we all have to push ourselves. No, it's not difficult, it's not impossible, you know write this somewhere. If Dr. Zabe can do this exam, I can also do this exam, okay. Write this in the on the front page of your notebook or any book, anywhere. Because all of us are brilliant candidates, all of us are the good students, isn't it? So if we are in this MRCOG business, it means that we have been destined to do this MRCOG. We have been what you can say, that chosen to be doctors first of all, and then chosen to do this MRCOG. So it's not going to be the something which is going to be the out of the world. Okay. So back in 2016, when I started off my, the MRCOG journey, of course, it was also difficult for me because I was also, the student at that time. I was also working full-time registrar, although I was FCPS from Pakistan at that time, but still, MRCOG was little bit, at that time, it was kind of difficult for me, and I used to think that because, my, the training was bit, the insufficient. I was not fully trained and I don't know, the many of the procedures, because at that time, what was our, the strength and what was our achievement? Oh my God, somebody knows, this big procedure. So he or she is a good doctor. But with the passage of time, I have learned, but with the passage of time, I have experienced, and also I have noticed that, okay, procedures, doing procedures is something else. But, if you don't have clear concepts, if you don't know which disease, which thing is coming from which aspect and how to deal with that, what are the causes, what are the risk factors, and how are you going to deal in the lines of evidence-based management? Doesn't matter if you are a good surgeon, doesn't matter if you know each and every surgery, you are failed. Why? Because that surgery, they can be, surgery can be done by whom? TDS, the people who are TDS technicians, right? OT technicians. So surgeries, OT technicians are, the better surgeon than us or anybody, isn't it? What MRCOG gives you? What MRCOG gives you? Anyone? What do you think that after doing this MRCOG, what are you going to become? Or everybody has only one reason to do this MRCOG? No, I have to move. What do you think that after doing this MRCOG, what do you see yourself to do everything with systematic approach? Okay, brilliant answer. Yeah. Mm-hmm. What is your aim? Okay, let me rephrase the question. What is your aim? Why do you want to do MRCOG? It's a smart study. Yeah, it is. Ayman, why do you want to do MRCOG? Saud, why do you want to do MRCOG? Adila, Amal, Anis, Furkhanda, Oliza, Noor. Why do you want to do MRCOG? I'm sure you must have thought, right? There is no value of SPS. Okay, okay, one thing. Okay, it's not a bad thing, You should have a very clear perspective that why do you want to do something. If you don't have the answer for that, trust me, you can't even move, okay, forward. So always remember that MRCOG gives you a very, the wide perspective to see something, to see a patient or a disease in a different way. Okay. So you won't believe that, like I've told you guys earlier, that I was FCPS when I entered into this MRCOG journey. Okay. But after doing this MRCOG, I have, the felt a gross change in me, myself, my counseling, okay, my behavior towards my patient, okay, and of course my management as well, isn't it? So what do you learn out of this MRCOG? Doesn't, it's not always theory, it's not always management. You learn that how are you going to communicate properly, effectively, and how are you going to prioritize your patients as well, isn't it? Unfortunately or sadly, the many of our systems, health systems, are not, the designed to have the patient friendly approach, or you can say that, the patient is going to be on top of, the everything. Because when we are going to offer some management plan, this MRCOG is going to give you an idea that once you are going to discuss the management plan, you are going to talk to the patient that, look, this option is there, this option is there, this option is there, now you tell me what is going to be your choice. Okay. And you will feel a vast difference in your communication, in your tone, in your behavior once you will become MRCOG. Okay. So in the end, in what I believe and what I think is that what MRCOG, after doing MRCOG, what your ultimate aim should be. Okay, it doesn't matter that if you want to work in UK or Ireland or any European country aside, you want to be beneficial to your community, isn't it? You want to be beneficial to your own, the people around, isn't it? So when you start talking, when you start telling them treatment, so you feel a gross difference after doing this MRCOG. Why? Because you are well read, you know every guideline, you know the every evidence-based management there is. Okay, so nobody can challenge you, trust me. After doing this MRCOG, alhamdulillah, I'm not bragging, but now I have this confidence that if somebody is talking in front of me bullshit, I always ask, where is it written, politely and humbly, of course, can you please give me the reference, where is it written, which guidelines are you following for this patient? Seriously, MRCOG gives you a very upper hand in your, the treatment management, or even if you are, talking, or even if you are having a discussion around, you know a part of a part of this perspective that you have to move. So always remember that, you have to become MRCOG. First of all, okay, aside your personal, the aim, but the being a doctor, what our ultimate aim is, our ultimate aim is to be productive, to be fruitful, to be good to our community, to our people, isn't it? Okay, so always remember and always think, like this. Trust me, and you will feel gross difference after doing this MRCOG. Okay, you will become confident. Exactly, you will become super confident, in fact. Okay, so always remember that you are studying. So if you are studying with a reason, it will be very the interesting for you, as well as, you will not feel it as a burden, that okay, because I have to do it, so this is such a big burden on me that I can't cope. No, always think that, like yesterday you guys have discussed, the venous thromboembolism guideline. I know it was very overwhelming. Till date, after becoming a MRCOG, it's been like 6 years. I still hate that guideline. Although I teach this guideline every other day, but still I hate it, because all the time I have to open this guideline, I have to revise, because the factors are kind of, never ending and overwhelming, and it needs a lot of, the revision and memorization. So it doesn't mean that I'm going to leave this guideline. No, venous thromboembolism is such an important topic. Okay, maybe we are not well versed, because we are not dealing with so much of low molecular weight heparin, and we are not talking, all these low molecular weight or unfractionated heparin every other day. But because you are in MRCOG syllabus, you are becoming, or you can say that you will be working in NHS. So in Europe, I'm sure you must have read that, the VTE is still, the risk factor for the death. So they prioritize every woman, at the time of booking, at the time of admission and postnatal as well. Okay, so please don't think that this is a burden. Always think that yes, it's good for me that if I read all these risk factors, so I can pick my patients that who is on the high risk of development of the VTE, either in the antenatal period, postpartum period, or even if it is a big gynecological surgeries as well. All right, so the make a aim all the time, and don't think that it is difficult. Yes, it is overwhelming, and I don't deny the fact that it is overwhelming, and all the time it will be till the day you will become MRCOG, because it's an the never ending process. Even after becoming MRCOG, you have to keep yourself updated. You have to be reading the all guidelines, talk articles, blah blah blah, all the things. Okay, so never think that if you have come this far, so become MRCOG. It doesn't mean that because MRCOG 2 is overwhelming and you are going to just leave it. No, you are not. Trust me. Bridges. Have you ever seen that the bridges? Bridges are always hard to cross. So in MRCOG, from MRCOG 1, 2, and 3, part 2 is a bridge. Okay, part 1 is just basic knowledge. Part 2 is a bridge, and part 3 is going to be just the piece of cake for you if you have your concepts clear. Because in part 3, what you need to do, you have to apply this part 2 knowledge to your patients, and that is going to be applied clinical knowledge. Okay, blended with communication skills. And whoever has the good communication skills, and by the time you will practice, by the time you will learn, and I'm sure you can crack this part 3 as well. But for part 2, yes, you have to study hard. Okay, so don't get upset. Don't be like afraid of trying for it. Don't be afraid of the aiming for this MRCOG, and don't be afraid of like kind of no, I can't do it, so I'm just going to leave it. Okay, so please stay strong. Okay, hang in there. This is not something out of the box. This is not something which none of the candidate has done in their life. I have been a student myself. I know how hard it is. All of us are the working, dealing with so many things. And all the time I say, and all the time many of you guys know me, that all the time I say that don't compare yourself with anyone. Don't compare your journey with anyone else's journey. Okay, we don't know. We can't fit in anyone's shoes, isn't it? I don't know what's going on in your life. You don't know what's going on in my life. If I'm the sitting here talking to you, it doesn't mean that everything has been perfect since morning for me. Maybe not, maybe yes. All right, but the thing is, if you are in this the kind of business, so make sure you are studying. All right, so let's get this started, and let me tell you that how are you going to the embed yourself in this success cycle. All right, so first of all, you need to make sure that you are patient. Okay, if you think that because I have never failed any exam, so every exam should be there for me and I should pass this exam as well. Remember, we are competing with the brilliant brains all around the globe. Lubna is brilliant, Mehwish is brilliant, okay, Saud is brilliant, the all of you guys, because I can't name all of you guys, okay, Rouge and etc. etc. Everyone is brilliant. All right. So do you really think that I'm little bit less than you, or you are less than me? No. All right. Everybody is brilliant. Everybody is like is a unique in their own way. So all you need to have is patience. This is success cycle. If you are not patient, and if you really think that today, because you have started your journey today, so tomorrow you should pass, and tomorrow you should stand tall with this MRCOG degree. Okay, be patient. Wait for your own time. Okay, because success is a the kind of it's not an easy process. You need to be patient. You need to be persistent as well. Be persistent, because I have studied today, I'm so tired. It was VTE guideline and I can't study this anymore, so I'm just leaving it. I'll take 2 to 3 days break, and I will resume. No, this should not be the strategy again. All right, study on daily basis. Persistence is the key to success. Trust me, for me it is persistence. Okay, patience is yes. Okay, so persistence. If you don't study on daily basis, if you don't think that you can't the take out time, study. Doesn't matter half an hour, 1 hour, 2 hour, 3 hour, one guideline, one page, but study. Okay, because this is not an overnight process. MRCOG2 needs, a hell lot of time, a hell lot of studies, concepts as well. All right, plus perspiration. Always think that, whom are you, the following, and what do you think that, somebody is going to give you. Okay, please, the all the time think and stay positive. So all these things, they makes an unbeatable combination for success. Please be persistent. Okay, don't just leave yourself like this, and don't just think that because today's topic was difficult, so I'm not going to do it, today, so I'm going to take 3 4 days off, and once you will come back, there is going to be a huge backlog to cover, isn't it? So what will happen then? Again, anxiety, depression, again, the kind of something which you cannot cope. And then you will think, no, 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 this is difficult. This is impossible. Everybody is lying. Everybody is kind of, pretending that this exam is kind of doable. So please be persistent. Okay. Be persistent and be patient as well. Okay. Having said that, being patient means, see, we all go for exam, right? What is the result of any exam? Trust me, what is the result of any exam? For example, we have done, the done a exam today, test, for example, this is a test. What is the result of test? Pass or fail, isn't it? Everybody wants to pass, nobody wants to fail. But which candidate fail? Trust me. What are the components of failure? Let's discuss this, because everybody wants to talk about success. What are the components of failure? Anyone? Hmm? Okay, or let me rephrase. What are the reasons of failing any exam? Thinking of failure. Yes, stay positive. If you think you will fail, you will definitely fail. All right. Like I said, in the morning, that failure, or the you can say that loser is the one who have not tried for it at all. Okay, at least try for it. Reasons for the failure are so many. I'll be talking about lack of confidence is one, yes. Overconfidence is one, all right. Lack of confidence, overconfidence, all right. Not being persistent, not being patient, okay. And being judgmental all the time, not being kind to yourself as well, okay. Not being kind to yourself. Me, myself, because I have not studied today, I was busy in the hospital, I was busy at home, I was busy, here and there, because I didn't study, so I'm not going to, forgive myself. I'm going to punish, myself. So that is also one kind of, the failure. So please be kind to yourself as well. Lack of partner support, absolutely. Okay. Because these exams are not only one person's exam. Trust me, these exams are families' exam. Okay. Families, you have to jeopardize so many things, you have to keep aside so many things, okay. Family, kids, the parties and the family, the gatherings here and there. I don't recall myself, the attending so many weddings lately, and I don't recall when was the last time I have attended any wedding. No idea. Okay. So it happens, it is normal for all of us. But once you will go for this, the MRCOG2, you are going to be like, I mean, kind of very overwhelmed and very, the lost. So first, Adila brilliantly put lack of curriculum recognition. So let's talk about what is your syllabus for part 2. Okay, let's talk about what is your syllabus. Brilliant. Okay, so first of all, you need to understand that in MRCOG2 you have got almost 18 to 20 modules. Not all the modules are going to be as such, but some of the modules are going to be, the integrated, some of the modules are going to be interconnected, and some of the modules are going to be like, the blended with each other, you can say, like clinical skills, teaching, appraisal, assessment, information technology, clinical governance and research. Okay, one module. Okay, core surgical skills, post-operative care, yes, makes one module, right? Surgical procedures, it will come under this. Okay, antenatal care and maternal medicine will be one. Okay, then management of delivery and labor room, labor and delivery plus postpartum problem That's going to be the one module. All right. Gynecological problems, yes, benign gynecology, subfertility, sexual and reproductive health, early pregnancy care, gynecological oncology, and urogynecology. All right. So you can see that, how many modules are there. Okay. Uh, okay, okay. Okay, Uruj. All right. All right. So what are we going to be talking about? That what are the modules? Okay. Know your curriculum in a good way. And now you have to prioritize which module carries the weightage, which module is extremely important for this exam, and which module needs to be covered at, the kind of, you can say, the earliest. Okay. So what do you think? Which module, almost all modules are important, but which of the following module is going to be the longest and the lengthiest one? Hmm? Which of the following module is going to be the lengthiest one? Medicine, Adila, brilliant. Maternal medicine. And if you will, antenatal care plus maternal medicine. Okay. So it is going to be, because internal medicine itself is a separate entity. But because we are going to be talking about in the lines of OBGY, so yeah, maternal medicine is going to be again vast. But again, you need to be thinking of that, what are the important topics? What are the important cases do you see in your ops population? Okay. Research part, nobody talks about research. Okay. If you want to say biostatistics, so from biostatistics hardly 5 to 6 questions will come. So don't jeopardize your 95 questions for 5 questions. Okay. For me as an exam candidate, because I've been through a kind of the so many exams, I'm sure you guys know me that I have FCPS from Pakistan, MRCOG from UK, MRCPI from Ireland, plus European board as well. So almost every exam has had biostatistics as a component, because it's our the domain as well. Okay. But trust me, I have never done biostatistics in my whole life. I just know the spelling, and I just know one definition: odd ratio. That's it. I don't know anything else apart from this biostatistics. I always think, because this is my weaker area, so I'm not going to touch it. Doesn't matter if I give 20 days, 1 month, 5 days, or even 2 months or 3 months. This is not going to go into my head. That's my weakness. Or you can say I'm not interested in doing this. So I have scanned myself, for myself when I was a student, for every board, every exam. So I used to think that how many questions will come from this, the particular topic. So hardly 4, 5. So then I used to think, okay, 95 and 5. I'm not going to jeopardize my 95 questions for just 5 questions. So if any one of you has this problem for biostatistics, sit with yourself, analyze that, can you do this biostatistics in like 3 days, 4 days, 5 days, or maximum 7 days? If the answer is yes, go for it, study, give time. If the answer is no, so this is going to be by humble and sincere suggestion, don't touch it. So work on your rest of the 95 questions. Got my point? Are you there? Hmm? Is it practical or no? So if you will narrow down your own weaknesses, your own strengths, trust me, you will never fail. So how do we fail it? How do we fail, the anything? Because biostatistics is my weakest area. So I am going to put my, the 1 month into this biostatistics. So what I'm doing, I'm wasting time. Okay. Ultimately, I'm not going to get anything from biostatistics. So why am I wasting my time? Why not, the cramming all these rest of the modules? So I'm not going to do any mistake. Out of 95 questions, for example, out of 95 questions, if I am going to correct, going to do the 75, or you can say the 70 to 75, or the 65 to 75 questions correct, so I think this is good. Okay. So out of them, 95, your aim should be that out of 95 questions, I am going to aim, this much, this much, this much. All right. So remember, we have to choose and we have to know our syllabus properly, and then we have to start working on our syllabus properly. So if you guys have noticed that me and Mehvish, we both have started off this MRCOG2, the syllabus. Okay, and I think it's been like 15 days today exactly. So we have started off with antenatal care and maternal medicine because I personally and truly believe that this is the longest and lengthiest module. So let's cover it first. So once it will be done, you will see yourself that the kind of inner relief in yourself that yes, I have covered the bulk of this ops. All right. So make sure that you are choosing your battles, the wisely. So pick yourself, the properly pick your battles wisely. So curriculum green top guideline is going to be almost 60%. Okay. Tog articles are going to be 20 to 30%. Nice guideline is going to be 20%. Okay. So all almost there are yesterday I've been counting. So almost there are 87 or 88 green top guidelines. Okay. 88 or 87. Nice guidelines are roughly 15 to 20, roughly. Okay. Tog articles, which are very much important, ideally you have to do at least 5 years recent togs and the old tog articles, which have not been covered by any guideline or something. Okay. But yes, you have to cover some faculty of sexual and reproductive health guideline, contraception guideline, some infections guideline, consent advices, MBRACE report, and some scientific impact papers. All right. So this you have to do. So now my question remains same. Which one of you be choosing the curriculum? Would you start your curriculum with this or this? Answer should be guidelines. Okay? Answer should be guidelines because it is important that bulk should be covered first. All right, bulk should be covered first. So cover your green top guidelines, nice guidelines, related tog articles. For example, if you are starting with according to the modules, so yeah, there are plenty of tog articles which are coming with the maternal medicine and antenatal care. For example, for maternal medicine, anyone, let's name the guidelines quickly. What are the guidelines in maternal medicine? Green top guidelines. Thalassemia. Okay. Sickle cell disease, we have got sepsis, we have got malaria, we have got GBS. All right. We have got the epilepsy, right? We have got which guideline? Which else? See, all important maternal medicine disorders. And rest of the maternal medicine disorders like thyroid disorders, like SLE, like multiple sclerosis, like asthma, they are included in the talks. Okay. So first you will cover, if you will cover maternal medicine. Okay. So yes, you are going to cover all green top guidelines, TOG articles, and from the NICE guideline, yes, diabetes, not to forget, hypertension. Okay. Two important guidelines. All right. So these two important guidelines you will cover from, the here. So remember, if you will start, and there are multiple strategies to start the preparation as well. Either you go from guidelines to TOG articles and blah, 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 or either you go and pick your curriculum module wise. Okay. So module is good. Module is good, isn't it? So if you have, the start date of your maternal medicine module and antenatal care, so try to, they take help, okay, from any mentor, any group. There are so many, the brilliant mentors around. Or if you are following us, so yes, we have made a complete module for this August and September, October. I will share shortly. Okay. So in August, if you finish your maternal medicine module, so don't you think that you will be covering, the many of the important guidelines and TOG articles from maternal medicine and antenatal care, isn't it? So please give yourself credit as well. Okay. Be easy on yourself. Okay. Don't be judgmental all the time. All right. So it's very good. It's very important. Working on your mental health is equally important. So don't always blame yourself that because I did not do it today, so I cannot do it forever. All right. So don't be like this. Okay. Got it? And from this FSRH guidelines, so FSRH itself is a diploma in the faculty and sexual and reproductive health in UK. Okay. So there are, I think, 50 plus guidelines. So for MRCOG part 2, you don't have to do 50 plus guideline. You are not going to be, the sexual health and reproductive health expert. You're not doing diploma. So what you are going to do from this FSRS guidelines? Let's have a look. Anyone? What are the important topics for the MRCOG part 2? Emergency contraception, CHC, all right? Contraception, yes, Aman. No, no. So STD is in the BASH guideline. Okay, I'm talking about contraception. I'm coming to that. All right. So in the contraception, CHC, progesterone only, contraception. You are going to do intrauterine contraception. You are going to do implants. You are going to do emergency contraception. You are going to do missed pills. Okay, or the how to manage the missed copra UCD, missed implants, and everything. So don't you think all these are important clinical the topics as well? Emergency contraception, we do get patients every other day in our OPD, isn't it? Every day almost. Yeah. So if any one of you does not know what are the emergency contraception the choices, what is the CHC choices, how do you manage the missed POP, how do you manage missed CHC, so do you think that you are able to go for this exam? Yes or no? No, right? See, you're not having basic concept. So how are you going to deal with your patients in your clinics or in your hospital if you don't have a basic idea? So likewise, for this MRCOG part 2 as well, in MRCOG curriculum, they are expecting students. They are not expecting consultants. Doesn't matter if you are working as an independent consultant in your own country. If you are in this MRCOG business, you are a student to, RCOG. Got my point? So please, bring yourself up to that level that you are learning from scratch and you are increasing in your knowledge from scratch. All right. So please unlearn whatever you have learned earlier. Okay. Even in your own board exam, because every board exam has different, the pattern for every country, isn't it? So it doesn't matter. So please step down, the one step, two steps, and become a student again. All right. Good job. Good Amna. Good Lubna. For consent advices, okay, again, consent advices. What do you understand by consent advices? Consent advice is going to be for, I am going for cesarean section. So don't you think that you are going to take consent from me? Yes. So you need to know, how are you going to counsel the woman? How are you going to tell her what are the risk importance? Okay. What are the risks there? What are the benefits for there? What are the alternatives? All right. So if you are going to talk about the risk, you are going to talk about from frequent risk to common risk to more common and the serious risk and then rare risk as well. Okay. Unlike the many of our systems, health systems, because we don't talk to patients so much. We just ask them that, okay, do you have to go for cesarean section? Yes. Or in our system, we don't take consent from the patient. We take consent from mother-in-law, father-in-law, sister-in-law, brother-in-law, and the husband. And unfortunately, patient is not given the prime, the importance. But for NHS, patient is going to be the one who is going to be giving the consent. So as an MRCOG candidate, so don't you think that you have to learn these consent guidelines as well, consent advices as well? Hysterectomy, total abdominal hysterectomy, vaginal hysterectomy, all right? Hysterectomy for complex cases, laparoscopy, diagnostic laparoscopy, therapeutic laparoscopy. So don't you think that you have to take consents? Yes or no? Yes, isn't it? So why is it difficult? Why is it difficult then? Why is it out of the box? Isn't it, the clinically relevant as well? So now you can see that this syllabus has been designed for you, for me, for all of us, for any OBGY candidate all around the globe, okay, to be a good and or you can say a better doctor. All right. Okay. Saud, coming to this BASH guidelines. Okay. What do you think that, what are the most clinically relevant, the infections do we see in our clinics? Name any. We do see chlamydia, we do see gonorrhea, we do see trichomonas, we do see candidiasis, we do see bacterial vaginosis, right? We do see, collectively we say everybody PID, PID, PID. So what is PID? What exactly is PID? What is STD? So what do you think, that is this out of the box? No. So if you will study all these guidelines, so do you think that you are going out of the way, or you are going just, here and there? No, right? So if you will learn all these guidelines, so don't you think that you will have a strong clinical background knowledge to treat your patients as well? Isn't it? See, nothing is out of the, the box. All right. So make sure that you are, again, for the exam, I'm going to be talking in the next slide that how many, the questions will come from which part and which part. Okay. And some important scientific impact papers as well, because that is also freely available and freely downloadable on RCOG website, like, the vitamin D, because we know that vitamin D is an important, the thing to be given to the pregnant ladies, isn't it? So we need to know what is the exact dose. We need to know how we are going to prescribe, what are the side effects, and how we are going to, talk to them. Hysteroscopy, important. All right. That the on laparoscopy, if we talk about, then yes, we do have a scientific impact papers. Another one, the morcellation. Okay. So all these topics are important. So learn to, the differentiate, learn to have a gist of this exam, that how are you going to go for this exam. All right. So if you will just think all the time, no, 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 this is something, I cannot do, so you cannot do. All right. Clear, everyone? Hmm? Brilliant. Okay. Okay, so I want to shout out that, all of you have got this knowledge, that what exactly the curriculum is and how we are going to go about it. Yeah. Hmm? All right. Good. Okay, now question arises, how to successfully fail in exam. Interesting, isn't it? Successfully failing an exam. I don't want to fail any exam, but I'm failing. Yeah. So what is the reason behind? Let's talk about it. Like, the Amen said, lack of confidence. Yes. For me, it was overconfidence. Trust me. So let me tell you, because myself always give, the example to every candidate, that I have failed this exam as well. So has it made me a bad student to not to become MRCOG? Lubna, do you think that, because I have failed this exam, so I don't deserve to pass this exam? Lubna, what do you think? Yeah.
Yes, hi ma'am.
Hmm?
Actually, you already said that because of your overconfidence, that's why, that's the reason.
Exactly. I was very overconfident when I the was going for this exam, because I was already FCPS, and I was like, over the moon, that, no, I'm going to just, the pass this exam, and I don't have to study, because I passed my FCPS in first attempt. Okay. Theory, talks, blah blah blah, everything. So I was like, I mean, kind of over the, the moon, you can say. So I was very overconfident. But trust me, overconfidence also is a disease, and it's a very dangerous disease, because you don't know what you have done to yourself. Although I have failed this exam with narrow margin, 2% only. 62 was pass percentage, and I failed with 2%. And I failed in OPS EMQ. Okay? I failed in OPS EMQ. Yeah. And back in 2016, we never had so many mentors. Trust me, nobody used to guide us. So me and my friends, we used to study on, the one Facebook group. We used to fight, we used to study, we used to, the kind of, you can say that, do everything together. Okay. Now I was coming to that. Luck is something, we believe in. Okay. But for me, it's always hard, the kind of work. Okay. So if you do, luck is always there. Of course, everything has been destined, and there is a time for everyone. Okay. But remember, if you have covered your syllabus properly, if you have done everything properly, if you are confident, and if you are, the kind of okay on the day of exam as well. I know so many candidates who study a lot, who study day and night. They don't work, they don't go anywhere, they don't have any social life or something, and they study, study, study all the time, but they also fail. And I know so many candidates who try to keep a balance. Okay, they do job, they do hang around, they do give the time to the family as well, plus they do study as well. Okay, and they do pass. Which factor decides, you know almost 60 or 80% that this candidate will fail or pass the exam day? Okay, doesn't matter if you have studied so much in the last 6 months, 8 months, and you have covered so many sources, you have attended so many courses. Doesn't matter if on the exam day you are not in your right frame of mind, you are not the up, you are not in your own senses. So doesn't matter those courses, that mentor, this mentor, this course, this recording is not going to help. Okay, so this is very much important. Exam day is the you can say that the decisive, the kind of day for every candidate there is. Before that, of course, all these things will matter. So because we are talking about how to successfully fail, so lack of confidence, overconfidence, following too many advices. Today there are so many webinars happening, so everybody has joined in with different ideas here and there, and I'm listening to that person, I'm listening to that person as well. So I mean, there is no harm, but what are you doing? What are you doing? You are getting confused. Okay, because somebody is telling something else and somebody is telling something else, because everybody has different experience. But always remember, take advices from the experienced one. If you will take advice from everyone there is, you will be confused. Okay, and you won't be knowing that from where to start and how to start and what to follow, what to study properly, and what to cover the first in the syllabus. Plus following too many sources from one topic. For example, day before yesterday we have done epilepsy green top guideline, and there is a talk article on epilepsy as well. Okay, there is no harm in studying both, because it's very tempting, isn't it? Because once you try to the study one topic, so it becomes interesting, and it is very tempting for all of us as a doctor as well, that we do try to study, we do try to dig out everything. But what are you doing if you think that you have a GTG green top guideline on the same topic, and if you are studying the TOG article on the same topic as well, so you're not doing a good justice to yourself. Okay, so first cover guidelines, that is bulk of your exam. Okay, so don't study too many sources for one topic, and don't open any theory book, the big fat theory books like Dewhurst, like evidence-based management, like high risk pregnancy, like Shaw's, like Jeffcott. Okay, no, please don't open until and unless you don't have any clear idea about any topic. Plus following so many or almost every single group on social media, because this is an era of social media. So we are so active on Telegram, we are so active on WhatsApp, we are so active on Facebook. No harm in joining anything, okay, until unless it is beneficial for you. But if you are just scanning questions every day, if you are just the attempting questions every day, and there are plenty and plenty and thousand of the messages on every single group, so what are you doing? Again, you are wasting your time, isn't it? Again, because you have to keep yourself the relax as well. Plus this the apps, or you can say that the use of the screen, it also puts this strain on your eyes, brain, and your back and your spine as well, isn't it? Neck pain. Okay, so please be easy on yourself, take good care of your mental health, your physical health, everything, because by the end of this preparation, you don't want to see yourself as a kind of the sick person, or as a kind of a very tired and demotivated person. All right. So by doing all these things, what is the result? Demotivated, depressed, tired, and all the time having headache person. The other day I was talking to somebody and he was telling me that, ma'am, I'm all the time I'm having headache. Yes, that makes sense, because we are getting stressed because somebody is studying too much, because she is answering every question, she is present in every social media, she is present on every the group. So I get, the kind of very much impressed, or maybe envious, or maybe, the jealous, or maybe something. Okay, so I will start comparing myself to her. That should not be the the approach again. Okay, so I would suggest to all of you, doesn't matter, if there are plenty of groups, there is no harm on being part of, the so many groups, but follow one or two groups. That is sufficient. You don't need to be part of so many groups here and there, and then, that is going to be guaranteed success for you. Follow one schedule or two schedule, that is more than enough. Okay, so please, the because by reading thousand and thousand and messages, you're not doing justice to yourself. You are putting strain to your eyes, brain, the neck and spine as well, isn't it? By the end of the day, you are not going to be in the right frame of mind to study for yourself. You will be just having headache. Okay, so please, justify and give yourself, the kind of the chance that you are being, the good to yourself as well. Okay, so don't compare yourself to anyone, and please don't be part of, the every single group. Follow two to three groups, that's okay. It doesn't matter. Following any group, is not bad at all, because it keeps you on track, it keeps you, the going, and sometimes you do get, the motivated as well. Okay, good job. Good. And now we will talk about how to successfully pass an exam. Uruj, are you there? Hmm? Because she was very, very anxious. All right. So, first of all, organize yourself. Having said that, organize means you need to know, according to your own circumstances, which exam is most suitable for you. Okay. You need to think of this thing. Organize yourself. Okay. First of all, for January exam, August, September, October, November, December, 5 months. I think it is more than enough. If you give your 100% effort into these 5 months, I think you can easily pass this exam. Nobody wants to study for years and years for this exam, because by the end it becomes, the very boring. It becomes, the very kind of difficult as well. You don't find, the interest in doing, the one guideline again and again. All right, so please organize yourself. Secondly, make folders of all modules on your desktop if you are a IT person, or if you, they love to, the study online. Okay, iPad, MacBook, or even, the anything. Or you can get them printed as well. For me, because I'm a hard copy person, old candidate, right? So what I have done was, I bought my own printer, and since 2016, and it's been like 8 years, that printer is with me, and it's still working fine. So every time what I will do is, and second thing is, learn how to best utilize Google. Make Google your study buddy in MRCOG journey. Everything is freely available on Google. Don't worry here. Don't, the look for, the PDF copies here and there. Yes, everybody here is helpful. You ask somebody. Okay, you ask somebody, and the everybody is be ready to help. Like today, Saud, they shared one guideline, and I was very happy. Okay, so all of us are, they're very helpful to each other. But learn how to utilize this Google as well. www.rcog.org.uk. Type this URL on your Google, and you will get every guideline on your, the desktop. Download it and then get it printed. If you want to study hard copy, buy your own the printer. It will be very helpful, and I will tell you how. Because then you have to have, the if you want to make your own notes, if you will start reading one guideline, you will emphasize on facts, figures, percentages, incidences, recurrence, prevalence. Okay, and have a good grip on all salient points from guidelines and TOG. This is important. This is the key for my success in almost all boards. you have to make a separate folder of all algorithms and charts to revise from. Okay, having said that, if you guys have noticed, almost all green top guidelines, they do have the management charts in the end. Okay, important charts. So print them, make a separate folder. Okay, and even on the back of that page you can write down important points from that particular guideline or tog article. So in the end, what do you have? One, the ready-made summary to revise from. So what I did was, when I was studying for MRCOG part 2, my whole study room was, the pasted with all these pages, the charts. Even those charts were, the pasted on my, the doors, windows, okay, my table, my almost every wall, okay. So if I'm sitting, I'm revising, the standing, I'm revising, I'm going out of the room, I'm revising, I'm coming inside the room, I'm revising. So by the end of my exam, when I passed my exam, so I had to do, the repaint my room again. All right, so this is also important. So make sure that you are doing this to yourself as well. Make a separate folder. So this printer will be your best buddy, this Google will be your best buddy in this MRCOG journey. So please do that. All right, so even if you don't find any guideline, write in the any group, so we will definitely try to help you. Okay, plus this is also important, discussion helps. Post as many questions as possible and from all available pool. All available pool means you have got books, you have got the almost every source there is. There are plenty of Facebook groups, Telegram groups, they are full of questions. All you need to do is use search bar. Use search bar. Okay, you have to use your search bar and your life will be easy. Okay, so use search bar, or because almost all books are the old, but yes, in 2020 Justin Kuhne book came, 2021 Andrew Sizer, and recently in 2023 Tahir Mahmood second edition. Okay, so please buy all these books, keep them with you. Hard copies is always good because you can the kind of write down if you want to, but don't solve questions with pens. Do use pencils so you can erase, you can use the same book again and again and again. Okay, if you guys will see my books will be like the like you have just bought them today, even though I have studied all these books myself. But yes, it is important that you study all these books properly. Use the pencils, not pens. Okay. Yes, you have to paste all these the things. So do try to do that, trust me, it will help you. Like yesterday we have done VTE guideline. So from VTE guidelines we do have there's so many algorithms and charts, isn't it? And that needs a lot of repetition and revision. So, and that will only come with the passage of time. That will only come once you will scan them again and again, try to revise them, memorize them. So what I used to do was, for example, if I have to memorize that chart, so what I will do, okay, factor, the no score 4 is this. So while I'm sitting, I'm the revising again, score 4, score 4, score 4. Two things are score 4, if I'm not wrong, right? OHSS score 4, all right, and the any recent the emerging BTE score 4 in the pregnancy, right? So score 4 is there, OHSS is there, hyperemesis is there. So it is going to be which score, so I will memorize like this. So today in the morning I memorized score 4, in the afternoon score 3 things, in the evening rest of the things are going to be score 2 or score 1. Again, prioritize, you know so make sure that you are first of all memorizing score 4 and score 3. Rest everything will be score 2 and score 1. Simple. Okay, so it's not a very the kind of difficult that if you will they try to look at that chart again and again and see, oh, this is so difficult, I can't do it. Look now, isn't it? Right, so revise them. you know try to think that how you can make your own mnemonics. Okay, how you can I'm sure every all of us used to do that. while we were students in our MBBS times, isn't it? So we used to make, so many mnemonics here and there, and we used to memorize. So why not now? Why are you waiting for someone to make things for you? Make things easy for yourself as well. Okay, we all do that, all right, and we have all been doing that. So why not now? Why this is something out of the box thing that you can't do it, please. Okay, again, I don't want to sound repetitive, but trust me, be easy on yourself. Okay, take things easy, take things lightly. Okay, try to keep a balance between your work life, your studies, your the personal life as well. All right, nobody can study 24/7. Okay, so please make sure that you are having a good me time as well, where you can emphasize on your mental health too. Okay, so for this, the strategy, trust me, this strategy will work. Discussion helps. Discuss as much as you can. So that discussion will only come if you will open your mouth or if you will write. Otherwise, nothing will, they come into action. You will be just like, the Egyptian mummy, all the time looking at something and just thinking that I can't do it. All right. So please put your 100% energy into this thing that, okay, I have to discuss. I have noticed for the last 15 days, the Aman is posting. There's another student, Saira, she is posting on the Facebook, because Facebook is easy to track. Okay. Because if you will search, if you will use the search bar, for example, if you will write down SCD, sickle cell disease, you will find plenty of questions under that thread. Okay. So your life is easy. You can revise later on. So because Telegram and WhatsApp, they are very, the hard to follow because of the space, because of the the issues that the one question can't be pinned and one question can't be followed until unless you are using search bar again and again. Okay, so I think the Facebook is good. So yesterday, the two girls were having a good discussion, Aman and I don't remember another one. So two students were Adila, I think, yes. So it was very good. If you are not going to say why, what, and why are you giving this key, what is the reason of your answer, it's not going to be imprinted in your mind. Okay, back in our times, like 7 years ago, we just used to discuss because we never had so many mentors around. We never had anyone to they even tell us and even feed us how to study and what to study, where to start from, right? So make sure that you are having a good discussion. If you don't discuss, trust me, things are not going to be imprinted. For MRCOG part 2, there should be, the strong, the memory, and that memory is just going to be after, the discussion. All right. So do discuss, do discuss, do discuss. All right. Are you there, guys? Everybody is so silent. Questions is mandatory, sweetheart. If you don't do questions, things are not going to be imprinted. Okay, it will just go like this. All you need to have is concept, discussion. Okay, to have the things imprinted in your mind. All right. Plus, if any confusion arises, cross check, cross check from the latest org articles and guidelines for the reference. But again, what is your first reference? Guidelines. All right, and then you are going to look for here and there. Don't post any reference from any random Google article. Okay, PubMed article, the medicine.net article, any the any other article. No. Okay, your the reference is only your curriculum, guidelines, RCOG guidelines, nice guidelines, and then comes talk articles, nothing else. Still, if something is not clear, tag your mentor, tag your senior, tag your anyone you think that he or she can give good the reference. So you will get an answer. All right. This is also important. Make your own small notebook. Note down all important points from guideline or talk article you read. This is optional. Okay. For me, I make my own notes. Until date, those notes are with me. Alhamdulillah, and those notes have traveled all around the globe with me. Okay, So, I'm here if anybody needs them, because those are in hard copy, the handwritten. So, I mean, that's an open offer. Anybody who is in Karachi can get them printed. So, I don't mind. Okay. But the thing is, study them. And maybe something is important for me, or maybe something it is not important for you. All right. Plus discussion, like I said earlier. If you have a study buddy, that is very, very good. Lisa, very, very, very tempting. In fact, I would have done that. Actually, that how it works. So many papers, I think hundreds and hundreds. So it's not a good idea to scan them and make a PDF. But I do share time to time. Okay, if you are in Telegram or WhatsApp group, so I do share time to time. So you can have anything. So if you guys need any the summary handwritten, so I can provide if I have that, no problem. All right, discussion plus try finishing your first reading in 3 to 3.5 months and then revise in the next 2 to 3 times till exam. And first reading is always difficult, and I'm sure everybody of us knows that first step or first reading is always the difficult. Okay, so all we need to do is that the kind of just persistent. All right, be persistent, that's it. Study on daily basis, try to cover your first reading or first the syllabus reading, or even you can say the bulk in first 2 to 3 months, and then things will be very easy. Okay, so are we good to go? Are we on same page for the syllabus? Any questions so far? Good job, good job, good job, good job. Brilliant, brilliant. Okay, brilliant. All right, now let's talk about exam pattern. How this exam is and how this exam is going to be for us as well. So there is going to be two papers. One is going to be obstetrics, second is going to be gynecology. All right, but for me, I think it's a mix. It's not solely obstetrics, it's not solely gynecology, but yes, according to RCOG, yes. Secondly, paper pattern is going to be paper 1. There are going to be single best answers and extended match questions. Total duration is 3 hours. Single best answers will be 50 questions. EMQs will be 50 questions as well. So weightage, 100 out of 100 questions, 40% will be single best answers and 60% marks are going to be for EMQs. So you can say that now you have to put extra effort to solve all these EMQs, and to be pro in solving EMQs as well, because EMQs are quite the you can say confusing at times, little bit hard to the crack. Okay, we will do some EMQs today as well. Okay, don't worry, and they carry highest marks. All right, so roughly you can have a strategy that 50 questions you will do in 70 minutes, or 1 minute is okay, 1.5 minutes, and rest of the time should be done for the EMQs. So total 180 minutes means 3 hours. Okay, so after paper 1 you will have a break, small break, then again there is going to be paper 2. Okay, then like I said earlier, weightage 40% single best answers and 60% EMQs. So it doesn't matter, it doesn't mean that you are going to leave single best answers and you are just going to practice EMQs all the time. In exam, every single percent or every single question, the is important and it matters. Can you tell how to do oncology module? Yes, yes. Oncology module, FIGO, no. FIGO classification you have to memorize. You have to memorize this way or that way. Again, like I said earlier, okay, FIGO classification, endometrium has been changed recently. Okay, and it has got the little bit different classification than earlier, because earlier was so easy for endometrium, CA endometrium, but now it has recently been changed. So I think you can the kind of revise it again and again. Okay. For oncology, MRCOG-2, again, let me tell you, they are not expecting oncologist. They are just expecting for MRCOG, okay, they are just expecting that what is going to be the classification and how are you going to treat. Simple. Don't go into the depth. Okay, you're not oncologist. All right. So just the staging and treatment. That's it. And on the other hand, the cervical screening, that is important. NHS, the cervical screening program, that is very much important. All right. Okay. So knowledge based modules to focus on. How? Almost core surgical skills will have roughly 10 questions. Biostatistics will have roughly 6 to 8 questions, or say 5 to 6 questions. Teaching and clinical governance, at least 10 questions. However, maternal medicine module will have a major chunk of the OBS paper. Then oncology, urogynecology, benign gynecology will be major chunk of gynecology paper. Okay? All right, got this? So you have to cover first bulk and then come and try to cover the rest of the module. All right, again, sit with yourself. Don't get the kind of distracted with this thing that that person is so good in biostatistics, so I have to be good in biostatistics as well. All right, so don't keep this biostatistics in your head all the time. Okay, if you don't remember anything from biostatistics, so leave it. Again, I will be repetitive and I will be repeating this thing again and again. Don't lose your 95 questions for just 5 questions. Focus on your 95 questions. All right. So make sure that you are aiming the big thing. All right. Then comes strategies to solve questions. How are you going to solve questions? Dilemma, isn't it? Everybody is in a the kind of a fix that how we are going to do. Although we have been doing questions, we have been going through all these exams all the time. We have been through OSPI, we have been through OSCE, isn't it? From our MBBS times to our the postgraduate times as well. Then why afraid now? The only difference is language, maybe. Okay, and that language will come into action in part 3, not now in part 2. All right, because once you are going to talk, once you are going to communicate, only in that scenario your communication will come into action. Otherwise, theory needs to be on your tips. So how are you going to solve questions? Revise your own notes time to time if you have made any. Revise all algorithms on daily basis in one dedicated hour when you are fresh. Like for example, from we have started our schedule from 1st of August. Whatever guidelines you have read, so just the scan that which guideline had the algorithm, print it, keep it in a separate folder. Okay, or even if you didn't print it, okay, scan it and keep it in the separate folder. By the end of your the preparation, you will have your own folder ready to revise from. Plus you can start one book or you can do module to module. I always prefer this module to module. It's important and it's good. You know, you have got the plenty of books as well. You have got so many things with you as well, isn't it? Thank you, Lubna. Thank you so much. Module to module is always good. For example, I have picked today benign gynecology module and I have read almost 7 to 8 topics. I know polycystic ovary is there, menopause is there, the PMS is there. All right. So what I will be doing then? I have all MCQs and I have all question books. Okay. There are almost 11 books. I do have all 11 books. So what I'll be doing is that in the morning, if I have read the guideline, so in the evening or at night before bedtime, I will do questions because guideline needs thorough and focused study. However, questions can be done, while you are, working, while you are busy here and there or whatever. Okay, like for me myself, when I was studying for part 2, I had my study partner from India. Okay, and we just had only half an hour difference, so we used to study over phone. I was working full-time registrar, she was working full-time registrar, but still, we used to try to, the study on daily basis. So in the morning, she was also morning person, I was also morning person. So in the morning, I used to study before going to the, the hospital and work. So while we used to come back from hospital, we after having, the lunch and blah 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 everything. So we used to discuss. So what we used to do, there are, for example, 10 books. So we used to say that okay, you know, 5 books you will pick, 5 books I will pick. So we used to search while we are on phone. We used to search the questions, 5 books, and she used to say, okay, Zeb, page number 22, there is a question on PCOS, 2 questions. Okay. Then I used to say, okay, Anu, pick this question, page number 82. There are 5 questions on this. So this is how we used to do the books as well. This is one, the idea how to do the books with your study partner. Now we are giving you guys opportunity that there are brilliant candidates, the students who are putting efforts and putting all these questions from all these books on the Facebook. So do study. Is it hard to just type your answer A B C D E? Hmm? Is it difficult? Hmm? Yes or no? Everybody has gone into deep sleep. Yes. So please do that, solve them. See, we are making your life easy. Being a mentor, I really want the things which I have never had while I was studying. So I really want everybody to have those, the things to revise and to study from. Okay. So we should be thankful to all these, the students who are taking out time, who are searching all these questions from all books, and they are posting. So please do answer this for you. I am done. I have done this exam long ago. I have done this exam long ago, and I am guiding and I am teaching since long. Okay. So with the passage of time, I have learned that how to make things easy for students. So by the passage of time, I have learned that hashtag and the solving all these questions is very important. Let's discuss. Okay. Don't just write ABC. You know, if you are going to be writing ABC, give your reason. Trust me, you are not going to waste your time like this. Okay. If you will be busy in your, for example, you have done epilepsy guideline today in the morning, in the evening you have done all these questions. So don't you think you will be in good shape? In the morning you will be confident, you will feel good. Even out of 20 questions you have answered 15 questions correct. So I think this is good, because this is your first reading. And once you will revise again, things will be easy for you. Once you will revise and revise, things will be imprinted in your mind. Okay. So go module to module, because not every book is according to the module. So make sure you do a collective study. You guys are very awesome, you guys are studying in group. So please make sure that you for example, Uruj has picked Justin Pune book, Eamon has picked Andrew Sizer book, you know Shabana has picked some the else, something else. Rabia has picked something else. So what you will do, you are going to just search your own book and you are going to post. And by the end of your preparation, trust me, these books will be on your tips as well. By the end of your preparation, you will feel good. You will feel, and you will say that, hey, I'm awesome because I have done all these books, right? I have done, I know this question is from which book. Like for me, I'm not bragging, but trust me, Alhamdulillah. Now, today, if you are posting any question, I can tell you this question is from that book. Okay. This the line is from that guideline, that para, that part, upper part, lower part, in the middle. So this comes with practice, this comes with time. Okay. So do that. All right. So give equal attention to theory and questions. Don't just solve questions all the time. Divide your time for revision and questions as well. Thank you so much, Uruj. This is what I really wanted, and I really wanted you to join as well. Okay, because I know you were very apprehensive. Okay, but have more focus on EMQs. Mark your weak area and then give extra revision to that area. All right. If you will solve question, you are not going to help me. All right. What is the role of I am telling a story. Now you are asking me Zulekha was a female or a male. Yeah. Okay. So all these books is important, isn't it? So top picks should be Andrew Sizer book, Justin Kuhne book, Tahir Mahmood book. Now there is second edition. Please buy everyone. Okay. There is no PDF, otherwise we would have shared. Okay. There is only hard copy around. This is very important. Rekha Butankal, I love this book. This is Amanda Jones. This is the P. Sinha book. So all these books are important. Doing all these books doesn't mean that you are doing and you are the following curriculum. These are all practice books. This is not your curriculum. Mastering, yes, but I don't know. I keep mastering in the end, and mastering is good for the single best answers. I always keep mastering in the end. Okay, and rest. This. The Shrimishta for succeeding. This the Brian Magwan. This is very good book. Get through. It has got two parts. One is for AMQ. One is for SBA. So how many books are there? Two books, three, four, mastering five, six, seven. It has got two parts, 8, 9, 10, 11, 12. What else you need? What else you need? 13 practice books are there and still everybody is crying. कहाँ से करें, कैसे करें, क्यों करें? Do you think it's difficult? Huh? 13 books are there and are the practice books. All right. So if you will the practice all these questions, so don't you think that you will be revising all of them again and again? Yeah. Yes or no, everyone? Hmm? Yes, Zahra, very good. Yes, you will be revising. By doing all these questions doesn't mean that you are the just the covering the one your curriculum, but you are just practicing how to attempt single best answer and how to attempt all these the EMQs as well. Okay. Yes, Uruj, brilliant. This is what I was suggesting earlier, right? If you pick this book, other candidate pick this book, other candidate pick this book, 11 books are there. So if everybody is putting equal effort and everybody is the doing the all these things, so why not? It is important. Please forget about recalls. We are not talking about recalls in the beginning of our the preparation. You have not done your syllabus, you have not done your the one reading. Do you think that you can do the recalls? Hmm? No, please forget about recalls. Recalls are my least favorite options to do. Always choose the standard questions, standardized books, so at least you have a complete idea about the single best answers and EMQs. Recalls are collection, you know collected by students like you, like me. Do you think it is humanly possible to write 200 questions after coming from that stressful day and in a very correct and a very, the good, the way with all options? Yes or no? No, right? So, I mean, what I'm doing? Nothing. I may be writing the wrong, I may be recalling the wrong question, but for the upcoming candidates, this is a kind of the something that if they don't do recalls, so they will fail. No, it's not like that. Okay. Yes, scan them, do them, but in the end of your preparation, in the end of your preparations, once you are done with your reading, one reading, two reading, three readings, plus you have done all these practice books, you have done strategy questions, or if you really want to do the standardized question, do take subscription of Pass MRCOG and then do all these questions. For me myself, I think I have done recalls only once for part 2. I have not done so many, but I have done all these books, trust me. I have done all these books. I have done strategy, e-learning questions. I have taken subscription at that time, and I have done Pass MRCOG as well. Till date, I always take subscription because after MRCOG you have strategy yourself, so I take pass MRCOG subscription as well, just to keep myself updated that what are the new questions, what is the new pool, and how we can, upgrade ourselves. All right. So be positive on towards what you learn and try to absorb it with examples, references, and reasoning. It is important. Okay. So if somebody has given the key A, but you think the answer should be B, always, the ask why the key is A, why not B? Or if you have a very, the valid reference, so give your reference. Okay. Take a screenshot, post it, discuss it. This is how you will learn. All right. Am I clear so far, everyone? Hmm? So revise, revise, and revise. Okay, revise. So give equal attention to your body, your brain, your the cells as well. Red cells, white cells, platelets, blah blah blah, everything. Very important. Okay. So make sure that you are not being the very cruel to yourself. Be nice, be easy. Okay. Give yourself time to absorb things as well, because human mind, human body has capacity. Okay. Once capacity is reached, so you can't do any new thing. All right. So make sure that you are the giving yourself equal time. All right. Clear, everyone? Any questions so far from syllabus, from how to study and why to study and what to study? Yeah, strategy must be covered. Yes, yes. Take subscription, be an RCOG associate, and cover it up. It's very important. Okay, good job. It's MRCOG, no MRCOG until unless you become MRCOG completely, then there will be any value. Otherwise, part one no value, part two no value. But yes, overall MRCOG has a value. Okay. And you will stand tall, trust me. If you will do MRCOG, you will stand tall amongst all your fellow colleagues, because you will be confident. You will have all the um, references, you will have all the reasons and all. Okay. EMQ workshops, yes, you will have. Okay. And yes, venues are there in Lahore, so many, in Islamabad, in Karachi, even in Multan. Okay, in every city almost. In Hyderabad, yeah, so many venues. Don't worry. Like part one has had, similarly part two will have. Okay, brilliant. Why are you after recalls? Do you think exam is of only recalls? Hmm? Yes, UK has so many, so many. Sidra, why do you want to just do recalls and pass exam? Hmm? What is the specific reason behind? Practice, practice, do practice as much as you can, but don't memorize them. Don't memorize them. Okay. Question is one line, two lines. Do you think that is exam question? No. Just scan which topic is being asked, frequently, which topic is being, the repeatedly asked in, the recent years. For example, labor and delivery will never change. So don't think it is from recalls. Okay. Hypertension, diabetes will never change. So don't you think it is from this question is from recall. That is your frequently asked important topic for exam, your curriculum. Okay. Yeah. Yes, sweetheart. Let me tell you. Justin Kune book. Justin Kune book came in, I think, yeah, 2020, if I'm not wrong. Okay. Andrew Sizer 21, because these two were COVID gifts. Andrew. Okay. And Tahir Mahmood 23. That is the recent editions. Okay. But still make sure that you are looking at all these, the answers yourself. Okay. All right. So these are recent additions according to my knowledge. Justin Pune 2020, Andrew Sizer 21, Tahir Mahmood 23. All right. Thank you. Welcome. Welcome. All right. So let's practice some of the questions and let me tell you how are you going to pick the answers and how are you going to choose. Okay. Do discuss, as many as questions possible, including recalls. But don't just think that after mugging up all these recalls, you can go for this exam. All right. Don't do that. This is such a grave mistake. Don't fall for the trap. All right. Don't do this mistake at all. Do all these questions, do all these books nicely. Trust me, by the end of your preparation, you will be in, the good shape to go for this exam. If you will exhaust your neurons before exam, so what you will do on your exam day? Then eventually you will fail. And then you will blame that mentor, that course, that person, that, no, I'm sorry. I am not going to be at your place in your exam. All right. So you can't blame me after, preparing all these things. Got my point? Okay. So make sure that you are preparing in a way that you are giving your 100%. Any course, any mentor is just going to guide you. They're not going to go at your place in exam. All right. That day is 100% yours. And that day only you are going to be in action. There is no weightage, sweetheart. Strategy is a helpful resource material. Strategy, you can say, is a theory as well as question bank of RCOG. Okay, that is an official, you can say a website. It has not any weightage or at all, and none of the question will come straight away from anywhere. Please again mark my words and write it down somewhere. If any question is coming from diabetes, do you think it is from recall? If any question is coming from hypertension, do you think it is from recall? No, these topics will never change. So, from these recalls, always extract that which of the topic is frequently being asked again and again, every year, every exam. So, put more focus on that. It means that has got a higher, the kind of importance for our COG, not the recall. Okay? Erase that recall word from your life. And recently they are not repeating any questions anymore. Hardly, I think, 15 to 20. That is nothing. If anybody who is solely relying on all these recalls and going for this exam, I'm sorry, you are putting yourself in trouble. What my point? So please, yes, I'm not against doing anything, but I am just telling you guys that how are you going to prioritize yourself and how are you going to prioritize questions and question banks accordingly. Okay. Got my point? Okay. Except in the end, recall should be in the end. Once you have covered your whole syllabus, then only. Okay. If you will do in the beginning, you will be lost because you haven't studied anything so far. This is your first reading. So if somebody wants to do the oncology now from recall, so I think you are putting yourself into a trap. All right. So you will be demotivated in the beginning of your preparation. So don't do that. Like I always say that, be easy on yourself. All right. Okay. So let's do some questions. It is doable. No, sweetheart, giving up should never be an option. Okay, giving up should never be an option. Always remember, it is. I'm not saying that it is just piece of cake. It needs a lot of effort. It needs a lot of the hard work. But it doesn't mean that you can't do it. You have been through so many exams as well in your life. So why this exam is like, I mean, something which you can't do? Okay, so let's do some questions and then we will quickly wrap up. Brilliant. Okay. So the first question is, an elective cesarean section is being performed on 30-year-old rhesus D negative pregnant woman at 37 weeks of gestation for placenta previa major. Arrangements were made and she is receiving intraoperative cell salvage transfusion. What would you be planning with regard of rhesus D prophylaxis in this woman, assuming the baby's blood group is unknown? Hmm? What is your answer? Anyone? I'm just going to tell you that how these questions are going to be picked. Any idea about red cell antibody screening? Hi, Manikam. How are you?
Fine now.
Nice. Okay. Yeah, Ulisa. Exactly. So IUCS, intraoperative cell salvage. It's a very, the now you will never forget to Rouge. Key is C. After IUCS, as a rule, you have to give 1500 entity. 1500 units entity. Simple. Rule. Okay? Simple. So answer is C. So how do you justify your answer? When intraoperative cell salvage is used during cesarean section in Rhd negative, previously non-sensitized women, and where cord blood is confirmed as D positive or unknown, you will give 1500 anti-D. Following the reinfusion of salvage red cells, and the maternal blood sample should be taken for the estimated estimation of fetal maternal hemorrhage 30 to 45 minutes after the infusion, in case more anti-D is indicated. Okay, so as a rule, after IUCS, you will give 1500. So if you look closely, we have got, the couple of options. Yeah, 500, 750, 1500, 2000, and then this as well. So if you have read guideline nicely, if you have made your own rules and concept that IOCS, by all means, I have to give 1500, you will never forget. Okay, so now you will never forget. Trust me. All right. Next question. You suspect MIA in a pregnant woman at 24 weeks of gestation in an ECG has been performed. What finding on the ECG would be highly suspicious, that is, which is the most sensitive and specific for an acute myocardial infarction? A, B, C, D, E. Very good. See, even though you haven't read this dog article, but you know what is the answer, because this is complete clinical. If anybody who has done some clinical rotation, so he or she knows ST elevation, right? So ST elevation is the the most specific ECG marker in the acute myocardial infarction in the pregnant and the non-pregnant state both. Okay, very good. Next question. See, if you see ST elevation, three options are there. New ST wave, depression, ST elevation. We know ST depression MIA is also there, STE elevation MIA is also there. New ST wave formation is nothing. But anyone who has not done this talk article, or who doesn't have any knowledge of this ECG or something, so please bring your common sense. Think about ST depression and ST elevation. So I'm sure every doctor has this basic knowledge that how ECG is there. P, P, Q, R, S, and T. So this is going to be elevated like this. This is ST elevation, MI, and that is more common type of the MI in the cardiology setting. Okay, good. Next question. A 27-year-old woman is on the list for an elective cesarean section for placenta previa. She requests for intraoperative cell salvage. What are the components of intraoperative cell salvage? IOCS, how do you do it? This is also a question which we don't tend to see in any guideline, but again, it is a general concept. So that's why I brought this question. So how do you think of this? You will collect the blood and just transfuse. You will collect the blood, filter and transfuse. You will collect the blood, filter, wash and transfuse. You will collect the blood, filter, wash, and irradiate. You will collect the blood, filter, wash, and treat it prior to transfusion as well. Hmm. Yes, it is. See, if somebody is saying that, oh my, this is not written in guideline, this is not written in, here and there. See, at least if somebody has, the any kind of background knowledge, clinical knowledge, bring that in as well. So yeah, Ruj, brilliant. You will collect the blood, you will filter it, you will wash it, and you will transfuse it. Okay, you're not going to treat the same blood and then you are going to, do that. So how intraoperative cell salvage work? For example, this is for the patients who do not want to accept the blood. We call them as Jehovah Witness. Okay, Jehovah Witness are the, they are very small community. They don't accept any blood, even entity, any blood product. Okay, so in this what happens is that, if a woman is going for placenta previa, so we will collect the same blood. We will put the blood into the IOCS machine. We will, see, we have collected it. We will filter it with the help of machine. We will wash it and we will retransfuse it. So that's why it is called as intraoperative cell salvage. And this facility is not available in every hospital in UK, okay, NHS. So if any woman who is Jehovah Witness, if any woman who is declining for any blood transfusion, so she will be referred to a center that, the gives IOCS. All right. So now you will never forget this question as well. All right. Now, next question. You have been called to the delivery of a 30-year primary gravida who's pushing. The baby is in the breech position. The midwife is conducting the breech delivery, and the head of the baby is trapped behind the cervix, which is only 8 centimeter dilated. What action will you take to deliver the head? Apply forceps, apply Burns Marshall technique, Maurice's Millivich maneuver, or incise the cervix at 3 and 7 o'clock position, or symphysiotomy. Yeah, Rouge B, Burns Marshall, 8 centimeter. What is Burns Marshall? In 8 centimeter, do you do any Burns Marshall? Hmm? Mhm. Yes. Okay, we will incise the cervix. It is written. The head is trapped. And 8 centimeter if head is trapped, we will do the cervical incision. We call it is what? You know, Duherson's, technique or Duherson's incision. So this is how you do. 3, 7, and 10 o'clock position basically. Okay. Every breech delivery is until the it is an emergency and breech is deeply engaged. Breech should be delivered by cesarean section. Doesn't matter primary, doesn't matter multi. Okay, according to guideline. But if a patient is coming into the labor already, okay, and head is badly trapped and cervix is not dilated, so you will cut the cervix, you will deliver the head, and then you are going to see. But again, the labor is a very complex process. You will think of so many things. Okay. In the conduct of a breech vaginal delivery, what maneuver should be used to deliver the arms? How do you deliver the arms in the breech delivery? This is a drill, surgical drill in our ops, isn't it? All programs, FCPS, MCPS, TOKes, blah, blah, blah. Hmm? How do you deliver arms? Yes, it is loffset. Okay? It is loffset maneuver. Burns Marshall is for what? Mauritius Millie with maneuver is for what? Hmm? See, this is how you do it, right? This is lobset maneuver. You will, place your hands gently by not, the putting the, the excessive pressure on the abdomen. You will do first, the rotation. Now you will do this. You will deliver the one arm, then you will rotate the baby again, and you will deliver the second arm. Okay. Pinard maneuver is for, the extended legs. All right. Lobset is for extended arms. All right. Then delivery of the head is one of the three. You will do gentle traction, or you will do MSV, Mauritius Millie Witt maneuver. You will do bracket maneuver like this, or you will do the Piper forceps. Okay. This is the, the simple way to deliver the breech delivery. All right. So if anyone, for example, because we are learning the techniques, if anyone who have not read the guideline, this way or that way, we all are working in OBG wards, isn't it? So if you have, any one of you have done breech delivery, okay, so you will know, eventually you will know that how to solve this question. So what does it says? It says that it doesn't mean that, everything you have to do from your guideline. Your background knowledge will also come into action in exam. All right. What my point? So please, if you are confused in one to two, the maneuvers, for example, here, at least you will remember that bracket maneuver is not for arms. This is not for arms. This is for, the delivery of head. So I am confused with these two. So I will narrow down my option. I will narrow down my option, and then I will choose which one is the best. Okay. Okay. Next question. What advice should be given to a 26-year-old woman suffering from epilepsy that has been well controlled with no seizures for the last 2 years, and she is on sodium valproate, who has attended for preconception counseling? Read question carefully and then answer everyone. Okay. Everyone, read question carefully and then answer. Hmm. Yes, we will change the anti-epileptic drugs to the lowest effective or least teratogenic drugs, and we will commence the patient on sodium valproate 3 months before pregnancy. Okay. So what this question is from? Guideline, of course, plus clinically important as well, isn't it? We do see epilepsy every there and then, epileptic woman, right? So it is important that even if somebody has not done guideline, so don't you think that you will be the thinking on the lines of patient that okay, the other day that patient came and we switched her onto this medication. And folic acid as rule, preconception counseling for every known case is 3 months before pregnancy. For every known medical disorder, there is a rule that every woman should be in the best possible health before embarking on pregnancy. Okay? Clear, everyone? Yes. It is associated with neural tube defects. It is associated with facial clefts, right? Autism. Okay, brilliant. So now we will learn the techniques for EMQs. Okay, let me conclude for single best answers. After seeing SBA 5 options, 1, 2, 3, 4, 5, right? You will exclude 1, 2, and then you will be confused between 3, 4. After giving another read, you will exclude this 4. Now you will have 3 and 5 option. What is your exam? Single best. You may think that okay, 3 is also okay, 5 is also okay, but which one is the best? That is your answer. What my point? This is, we call it as exclusion technique. You will exclude one top option, second option, third option. You will narrow down your next options, and then you will choose the best answer. All right. So single best answers are going to be chosen like this. Okay. And then what about EMQs? Thank you, Sneha. All right. EMQs. This is a headache. EMQs. Okay. So always remember in extended match question, there is going to be a theme. Okay. They are going to ask you that what exactly this question is. Okay. And then they are going to ask you to choose from. The trick to solve extended match question is you have to extensively match each question with all these options. So for question number 1, you will scan from A, B, C, D, E, F, G. For question number 2, again, you will scan. For question number 3, again, you will scan. You can use one option, the more than one, twice, or none at all. All right. So the first question is now, a 24-year-old, 32 weeks of gestation, returned from holiday in Brazil. She is vomiting, having fever, and complaining of severe headache. What has she got? Which type of headache? Hmm? Mm-hmm. Yes. Okay. Second question, a 28-year woman complaining of severe throbbing pain behind her left eye, headache at 26 weeks of gestation. She is unable to sit still because of this pain. What is this? Okay. D, migraine, Lubna. Why D? Hmm? Cluster. Okay. We will see. Unilateral. Okay. In third question, in postpartum period, a multiparous woman of BMI 43 complain of sudden onset of headache, describing it worst ever headache. What is this? Hmm? SAH. Okay. How SAH? I don't mind if somebody is asking SAH, worst ever headache. Okay. What another, the buzzword goes for this? Hmm? What's another thing? Worst ever headache. Okay. What else? Do you think every postpartum woman will have SAH? Hmm? And every worst ever headache is SAH? No, it's sweetheart. It is CVT, venous thrombosis. See, what are the characteristics of CVT in postpartum period? This is multiparous. Her BMI 43 and sudden onset of headache. Okay, sudden onset of headache in postpartum phase. You always see. Yesterday you have done VTE. What is the most vulnerable part of development of VTE in pregnant population? Postpartum, isn't it? Plus BMI, plus multiparity, plus postpartum. This is CVT. All right. C is fine. And why this is, what is the buzzword here for the headache? See, somebody has chosen migraine. Migraine can also be there, the pain in left eye. But in migraine, you might have aura or you might not have aura. Okay. In migraine, they will give, the buzzwords like, the flashing of lights, flickering of lights in front of eye, nausea, vomiting. All right. All right. It's not about, see, you have focused your mind on SAH. SAH doesn't exclusively come with this, the presentation. In the postpartum period with such BMI, you will have CVT as top most differential in your mind. However, if it was antepartum period, for example, 12 weeks, her BMI is 46 or her BMI is like 30, okay, okay, then it is going to be SAH, worst ever headache. Then I'll be thinking of SAH. All right, this is not migraine at all. Okay, in cluster headache, what will happen is pain will be at the one place, you know daily. For example, a patient will have daily pain, same time, and patient can't sit still. Patient will be drooling as the pendulum.
छोटा सा लेक्चर है मेरा। पापा मेरा 10 मिनट दे दो।
Okay,
इसको
patient will
लेके आप।
be, you know the patient can't sit still, and patient will be, drooling as a pendulum. Okay, so the buzzword here is she is unable to sit still because of this pain. This is buzzword for cluster headache. All right, pain behind right eye, pain behind eye. All right, patient can't sit still, severe pain, throbbing pain, each day, same time. Buzzwords. And the first buzz in the first question, why it is the malaria? Because she has returned from Brazil, endemic area. Plus, she is having vomiting and fever. Fever is always a acute complication of any inflammation, right? So you can't say it is conjunctivitis because you have seen fever. So what you will be looking at in EMQs? Anything which is with TIS or anything which is having any organism. All right. So out of this, CVT no, conjunctivitis okay, cluster headache no, migraine no, severe pet no, malaria, sinusitis no, gastritis no. So you are left with malaria, even if you don't know how to evaluate. So this is how you do the EMQs. So please read question carefully. Scan all these questions, the options again and again from A, B, C, D, E. This is J, but in real exam, you will have option up to S as well. So it means your scanning capacity, your scanning power should be up to the mark. Okay, that's why the practice is important. Okay, Sidra, clear now? Hmm? Brilliant. Okay, Uruj, clear? Mehvish, Iman, Anis, Simab, Shahid, Varda, Furkhunda, Saud, Oliza. Is it clear, everyone? Yes, it's not tricky, sweetheart. It's all about how do you read the TOG article. Headache. Okay, headache TOG article is my favorite article because I love maternal medicine, and I do teach maternal medicine with all of my heart and passion. So yes, you know, highlight buzzwords. Okay, so find out what could be the best possibility for every the question there is. All right, good, Zara. Thank you. Okay, next question. Now see, in every question, first you will see the theme. Each of the following women presents with problem related to glucose control in pregnancy. Select the most appropriate management from the options list. Okay. Now you have all these options and now you have 4 questions. So what you will do for question number 1, you will scan from A to J. For question number 2, again, you will scan from A to J, likewise, 3 and 4. That's why it is called as extended match question. Okay, first question and first answer, please be quick. So let's see. Even if you have not read guideline, if you are working clinically properly, or if you have seen 1, 2, 3, 4 patients of diabetes in your life, you will never forget. Do try to solve. Okay? Then I'll tell you. Mm-hmm. Question number 1. B. Zunera. Okay. Mm-hmm. Yes. Okay. Okay. Let's see. Question two is E. E is what? Induction of labor at 39 weeks. Okay. Mm-hmm. Okay, now C. Okay. See, this is insulin dependent. See, now for every EMQ, how you are going to pick? She is 37 years. She is insulin dependent woman with diabetes and preeclampsia, and now she is at 34 weeks. So, what exactly do you need to see in these two? Right? You are not going to admit. Why do you want to? Why everybody wants to admit? Zunaira, Zahra, why do you want to admit? Hmm? Everybody picked 2B, and I think Sidra has picked C. So, yeah, C makes sense, right? It has to be, the fetal-maternal surveillance because she has two risk factors now, diabetes and preeclampsia. Okay, so C. No, 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 no senior says. Nice. Okay, so next question. 32-year-old diet controlled, it means she must be type 2. Gestational diabetes or gestational diabetes at 36 weeks with an ultrasound scan that suggests estimated fetal weight of 4.5 kilo. The preferred option for delivery is recorded as induction of labor at 39 weeks. Whoever has said F is correct. All right. Okay. Yes, Zara, brilliant. Okay. Good job. And I think Sidra also said that, the F, good. Okay. So the GDM without any complication, you will induce at 39 weeks. Okay. Next is a long-standing insulin diabetes with retinopathy and nephropathy is booked for antenatal care. Antenatal care plan is modified because of increased risk of which of the listed option? H. Defer to day assessment unit for daily observation of mother because she is having retinopathy and nephropathy as well. At the moment, she is antenatal care plan is modified because of increased risk of which of the listed option. So listed option should be IUGR and PET. Okay, it should be G, I think, not H. IUGR and PET. It is G. Okay, that's my the typing error. It is G. So if any one woman who is having two complications earlier, so now she is at risk of IUGR and preeclampsia, isn't it? Diabetic retinopathy and nephropathy. Nephropathy will lead to IUGR and preeclampsia, both. Next is good. We need to 4 to 7 millimoles her the sugar is there. So the first trimester counseling for a congenital anomaly may be helped by which of the listed option? So she will have frequent visit and increased fetal surveillance. All right, poor blood glucose. So we need to see mother, we need to see fetus as well. Okay, clear everyone? So now see the trick. How do you, solve all these question again? Yeah. No, no, no. Dystocia is another thing, but you are not going to do cesarean section for every woman there is. Okay, you need to follow guidelines. So yes, yes, very close options. Difficult, yes. I must say it is kind of the difficult because so far you haven't read. But today I am just telling you that the tricks how you are going to choose between the two closest option, and how are you going to do the proper, the you can say that proper use of mind as well, even if you haven't read anything. So do try to think, clinically. All right. So for extended match questions, practice, practice, and practice. So there is nothing, which can be done without practice. Okay, good. Okay, let's do another set of EMQs. This is for the placenta previa. You guys have done anything, because this is also clinically. So we will just have a close, the look at this. A 32-year-old woman has her, just one moment. Key is already there. There will be cheating. Okay, so no cheating, yeah? Let's do it. Okay, so this is for placenta previa. Even if you have not done this guideline, so you will be able to choose with the help of your clinical knowledge. Okay, so let's quickly do it. A 32-year-old woman has her detailed anomaly scan at 20 weeks of gestation. The placenta is situated posteriorly, and it is suspected that the placental edge covers the internal os of the cervix. So what you will do in this scenario? Hmm? If any placenta has had, the anomaly scan, it is low lying. Okay, although it's not even low lying, it is covering the os. How many types of placenta previa are there? How many types of placenta previa are there? Okay, complete, partial. Hmm? Partial means marginal, low lying. Okay, and complete, two types, right? Major and minor. Yes. Okay, major and minor, right? Minor, it's going to be low lying. Major is going to be like, type 3 and type 4, partially covering the os, completely covering the os, isn't it? Minor is just going to be low lying but away from, this internal os. Okay, type 2 is going to be when it is, the less than 2 centimeter towards the os. Okay. Okay, so first we have said the F. All right, we will see the key. Second is a 32-year-old woman with BMI of 35 who has had two previous scars is found to have an anterior placenta at her 20 weeks, and further imaging, okay, is arranged at 32 weeks of gestation. The findings are similar, but the quality of the ultrasound image is poor. What you will do? K. Why K? Why H? MRI. Very good debate. According to guideline, you don't do MRI. Okay? No, no, no. It's not poor ultrasound. Is it poor ultrasound? See, this is how you choose. Okay? This is how you choose. No. Okay? This is not how you choose, sweetheart. This says that she is obese and it is transabdominal scan. So you will do transvaginal scan. Okay? You will do transvaginal scan. For any obese woman, you will perform transvaginal scan. All right. All the more reasons placenta previa should be diagnosed by transvaginal scans. Okay, if the patient is not severely bleeding and compromised. Okay. Next question is 28-year-old woman in her first pregnancy has a detailed scan at 20 weeks of gestation. This suggests that the placental edge is 1 centimeter away from maternal loss. These findings are confirmed by transvaginal scan as well. The pregnancy is otherwise uncomplicated. So what you will do in this case? By E. Zunera, do you do 28 weeks gestation scan? I don't think so. Either it is 32, either it is 36. There is no 28 weeks scan. Okay. He is KHF. Okay, key is KHF. Zunaira, okay, it's not E. You don't do at 28 weeks. Okay, make sure. Remember 32 or 36. Two things are there. Now let's see. YK, YH, YF. See, Sidra was correct in question number 2, but she didn't justify properly. Even if I'm saying that you are saying it wrong, so stay firm in your answer. Don't change your answer. Okay? You have said that ultrasound image is poor. Okay? That is fine. Now she has had 35 kilogram per meter square, 2 previous scar, and she has anterior placenta previa on 20 weeks scan, and further imaging was done at 32 weeks of scan. The findings are similar. It means another scan is already done, but the quality of the ultrasound image is poor. Now you can justify that yes, MRI can be justified. However, if this thing was not there, 32 weeks scan is not there, and this patient is with this BMI, has 20 weeks of gestation, so I will do transvaginal scan at the same time. Because why? She is previous to scar, and what I am afraid of? Acarita, right? Okay. So yes, in this question, MRI can be justified because they have done one scan at 20 weeks, then second scan at 32 weeks. The poor image quality is poor. So yes, MRI can be done. However, this is anomaly scan itself. If on anomaly scan we see that there is complete placenta previa, okay, then in that scenario, then yes, we will do, the TVS at the same time to reconfirm. And this is, yes, 32 weeks. For Acrita spectrum, no. We do not do MRI, but here it is given that ultrasound image is poor. Doppler is okay. All right. 3D Doppler is okay. Not MRI directly. MRI until unless you don't have clear answer, then only you will choose MRI. Otherwise, no. Okay. If you will read guideline, later, or if you have read it, so then you are going to do. All right. Zahra, okay. Okay, good. Okay, Claire? Clear now, guys? Any question? So, see, again, I will say that it sounds very repeated, the overwhelming. It looks very difficult. But if you will look at the questions again and again, if you read question properly, you will not miss anything. Trust me. Okay? Exams are not, the designed to fail us. Exams are designed to pass us. All right? Exactly. All right. So make sure that you are reading again and again. You are looking at the question again and again. All right. And then you are going to, do it. For me, for MRCOG Part 2, January 2025, I will be conducting more webinars. I may be doing the crash course and workshops, plenty of workshops as well. Okay, including TOG workshops, including recalls workshops, including, the SBA workshops and EMQs workshops as well. All right. So I'm going to announce the um, I don't know when, but I'm going to announce. So make sure that you be active, you study, you follow me, and you be in touch with me. All right. this way or that way, I am with you. All right, doesn't matter course, doesn't matter no course, because course are designed for, just for the dedicated study. All right, so it's not like that for by every means you have to come in the course, okay, and then only. No, I'm a teacher, okay, I'm a teacher and I teach wholeheartedly, I guide wholeheartedly. Whoever comes to me, they get guidance and I give them guidance. It doesn't mean that you have to take my course as well. If you take course, of course it will be cherry on the top, okay. So it doesn't mean that I'm not going to run the group, or we are not, me and Mehvish, we both are not going to do the same practice which we are doing, okay. Thank you so much. Inshallah, okay. So I'll be with you guys, all right. So inshallah, we will be studying, we will be doing, the hard work. So it's all that, you have to put your hard work, and success doesn't come from what you do occasionally, but what you do consistently, okay. Like I always say, step by step, one day one guideline, second day your mind is like, kind of trained to solve all these guidelines, okay. Then you are solving more, the questions, then more question, then see, syllabus is covered. All right, so be consistent, be persistent, don't be afraid of trying, don't be afraid of going for this exam. Trust me, nobody has ever said that every exam is going to be easy. I'm sure the candidates who have done, the any postgraduate qualification. So, we have been told a couple of times that this is not an easy exam. Trust me, but for me, FCPS has been a, the kind of piece of cake. I passed it in one go. Although that, it's such a difficult exam, nobody can pass in, the first, the trial, but I did. So it doesn't matter. Even if you fail, doesn't mean that you are a bad candidate. Maybe it was not your day. Maybe you were not, the prepared. Number two, maybe third, maybe particular day, you were not prepared for that particular day. You didn't take rest. You didn't sleep properly. You were following too many sources. You were just, the running after material. You were just running after notes from here, there, course, blah, blah, blah. If you will do that, you are just wasting your time. All right, just follow one or two sources, just follow one or two mentors, more than enough. Who is going to go at your place? No one, okay. Every mentor, try to gives you, the properly, the guidance, that's it. All right, I'm not going to go at your place, you have to go. I just can guide you, I just can, give you all my tips and tricks. I just can you tell you that this is how you have to attempt question, this is how you have to solve questions, okay. Again, let me conclude the session. Again, be persistent, be consistent, follow your mentor wholeheartedly, trust your mentor wholeheartedly, okay. Don't doubt, the intentions, and don't doubt the sincerity if somebody is putting the time, efforts in guiding you. It takes a lot of time, trust me, okay. Be persistent, do try to answer, discuss, cover your bulk first. And what is your bulk? Green top guideline, nice guideline, then comes talk articles, then comes, the rest of the guidelines. All right, so do try to cover your bulk first, do try to do questions. You have got plenty of pools, no need to go here and there, no need to ask for so many, the mocks and so many questions from here and there, right? Everything is at your place, everything is at, the your doorstep, I must say. Groups are full of, the free books, free guidelines, everything. All you need to do is extract and use them. All right, rest. Thank you so much for being here, guys. Thank you so much for bearing me, thank you so much for listening to me, okay, and being attentive as well. So this is going to be my success if you guys at least, that the take message, that you just need to be, persistent. All right, so inshallah I'll be conducting another, the session. Somebody was asking me to do sickle cell anemia guideline, so I might be doing the sickle cell anemia along with, the inherited bleeding disorder guideline as well. All right, or perhaps, the few more talk articles. So if you guys have not subscribed my channel yet, so do that, because there are plenty of, the sessions Those are, the freely available. So do that, listen to them. Okay, solve, the any question. If there is any query, do write to me. I'm easily available. All right. My doors are always open for all of you. Facebook, Telegram, WhatsApp, accessible. If I'm not there, tag Mahvish. Okay, she is going to answer. All right. So inshallah, I will see you guys some other day, some other time. All right. So be vigilant. So do try to, the follow. uh, okay, Varda. Well, the courses are there. Okay, I'm not saying that that course is good, that course is not good, but choose your battles wisely, choose your mentor wisely. Okay, so if you want to follow me, so you are more than welcome. All right. So I will be announcing crash course shortly, maybe by the end of August, and workshops as well. So these are not going to be with the hefty, the fee, because I'm not after money, because I just want to teach, and this is my passion, and I will not stop teaching at all. So hopefully, that is going to be very easy, and the for all of us, it is going to be kind of good. Okay, Varda. So please do get in touch with me. Do get in touch with me. Yeah, sure, sure, inshallah. Okay, looking forward to have you all. So inshallah, I'll be the seeing you all some maybe like after 10 days. Okay, by the end of August, we will plan another webinar, and we will do some. I will tell you guys that how to read guideline and how to read a talk article. All right, how does that sound to you guys? Yeah. I will tell you. I will open a guideline and I will tell you how to read a guideline and how to read a dog article as well. All right. Because today was that inherited bleeding order inherited bleeding disorders guideline, and somebody said it is such a small guideline because 82 pages, 80 pages, are not that easy to cover. But how to extract something from those 82 pages, that is your exam. And I'll teach you how to read a guideline and how to read a talk article. Okay, yeah, I know. Yeah, all right. So inshallah, I will see you guys, and I will teach you how to read a guideline and how to read a talk article, how to make your own notes, and that's it. And inshallah, it is more than enough to pass this exam. Okay. So see you guys, inshallah. Take good care of yourself and your loved ones as well. Take good care of your mental health too. Okay. Don't be so hard on yourself. Be easy on yourself. All right. Love yourself as well. Okay. See you inshallah. Okay. Good night. Shabba khair. Allah Hafiz. Bye bye. Thank you. Thank you so much, Shabana. Thank you so much. Yes, we will all go to Lubna's house in part 3. Oh, let me tell you, Ruj, I'm a part 3 examiner as well. So you might see me in part 3 too. Okay? All right, all right, all right. Okay, guys. Inshallah. See you guys, inshallah. Okay? Allah Hafiz. Bye bye.